It's day 16 of India's 21-day lockdown to stop the spread of the novel coronavirus. I'm Suraksha.
I'm Akhil.
Over the next few minutes, we will bring you updates regarding the spread of this virus across the country. Akhil, what do the numbers look like today?
Suraksha, as we go into this recording, 6,475 COVID-19 cases have been reported from India so far. Around 6,000 people are active reported carriers of the novel coronavirus in India. 587 people have recovered since they were first tested. The death toll has climbed to 202. ICMR has tested more than 1 lakh samples for COVID-19 from across the country, among which more than 13,000 tests were conducted yesterday alone. 16 new cases and 1 death have been reported from Karnataka today. With this, there are 161 active cases in Karnataka and the state has recorded 6 deaths. The state's 6th death is from Gadag. This was the only confirmed case in the district. An 80-year-old woman succumbed to the infection earlier today. It is suspected that the octogenarian contracted the infection at a family gathering on March 23rd. 10 people suspected of COVID-19 have been isolated in the state. Among the new cases, 5 are from Bengaluru, 3 each from Bagalkot and Belgavi, 2 are from Mysore, and 1 each from Mandya, Chikbalapur, and Dharwad. Across India, states are preparing for an extended lockdown as numbers of positive cases continue to rise. In Maharashtra, Dharavi, one of the world's largest slums, has seen 3 COVID-19 deaths in 7 days. This makes it a ticking time bomb as it has a high population density. So far, around a dozen positive cases have been reported from Dharavi. Mumbai now has over 350 containment zones. Maharashtra has over 1,000 active carriers now, and the state has recorded 9 deaths today. Tamil Nadu has reported over 800 cases so far and has 799 active cases. Delhi announced 20 hotspots yesterday and has proceeded to seal them off. The national capital has 639 active carriers. Telangana is at the 4th spot with 397 active cases. Those are the top stories as of now. Suraksha?
Thank you, Akhil. In national news, the centre has announced a 15,000 crore package to upgrade health infrastructure in states as the confirmed cases of the novel coronavirus are on the rise. The package, which is funded entirely by the centre, aims to build resilient national and state health systems which can combat future disease outbreaks. The funds will be released under the National Health Mission. Phase 1 will be implemented up to June 2020. Phase 1 will include support to states and union territories for the development of dedicated COVID-19 hospitals, isolation blocks, ICUs with ventilators, oxygen supply in hospitals, strengthening of laboratories, hiring of additional human resources and incentives to human resource and community health volunteers. A public interest litigation has been filed in the Supreme Court to direct the centre and states to nationalise all healthcare facilities, including private hospitals, in order to contain the novel coronavirus. The plea by advocate Amit Dwivedi stated that India does not have sufficient public healthcare infrastructure to combat a pandemic like COVID-19, and as a last resort, it needs to take the help of the private healthcare sector. As we approach the end of the 21-day nationwide lockdown, many state governments have stated that they are in favour of extending the lockdown for a few more weeks. The Odisha government has announced that the lockdown would continue till April 13th and the schools will remain closed until June 17th. It has become the first state in the country to announce an extension of the lockdown. The Supreme Court has sought a response from the Jammu and Kashmir administration on a plea to restore 4G speed mobile internet data services in the Union Territory so that doctors, patients and the general public can access necessary information during the corona crisis. Internet services were shut off on August 5th last year and only 2G services have been restored so far. Moving on to the COVID-19 operations in Karnataka, it has been 1 month since the first COVID-19 case was reported in Karnataka. With Bengaluru successfully completing the quarantine period for all the international passengers, the state government is now exploring the option to conduct random tests by choosing people from the red zones, where a high number of cases are being reported. Most cabinet ministers from the state are keen on extending the lockdown by 15 days. A final decision will be taken after discussion between Chief Minister B.S. Yadurappa and Prime Minister Modi. Restrictions might be eased in states from where COVID cases have not been reported. Following the salary cut for all members of parliament, Karnataka has also deducted 30% from the salaries and allowances for the legislators for this year. The resulting amount of 15.36 crore will be transferred to the Chief Minister's Relief Fund. The state government will also distribute ration for 2 months to around 2.5 lakh people without ration cards. Among the other decisions taken at the emergency cabinet meeting today, it was decided that GST remittals will be deferred until June. The Karnataka State Task Force led by Dr. Devi Shetty submitted its recommendations regarding the lockdown exit strategy to the government. The recommendations by the task force include closure of educational institutions until May 31st, while allowing IT companies to resume operations with 50% manpower. The task force has also advised the government to allow shops without air conditioning to open, and interstate borders should be open but only for movement of essential goods. The State Health Department has issued a fresh circular on Thursday that the public should wear homemade masks whenever one comes in contact with a stranger. According to the circular, masks should be worn while shopping, when attending office work, and whenever there is an interaction with a primary or secondary COVID-19 contact by chance or choice. The Health Department has recommended a mask size of 9 inches by 7 inches for adults and 7 inches by 5 inches for children. Old cotton clothes can be turned into masks. Synthetic or semi-synthetic material is not advised. The circular also says that the mask can be reused by washing in hot water and ironing. However, only medically certified masks are recommended to protect from bacteria and viruses. The Karnataka State Police has taken up a special initiative to combat fake news. The initiative comes at a time where the false news about corona, as well as hatred against a particular community, is being spread rapidly. You can now verify the facts on controversial videos, photos, or posts on the website before sending them to others. The website address can be seen on your screens. In Dakshina Kannada, the district administration has identified Justice K.S. Hegde Charitable Hospital at Derlakatte on the outskirts of Mangaluru for treating patients from Kerala. Patients from Kasaragod will not be allowed admission in any hospital in Mangaluru. According to the conditions laid down by the district administration, a government doctor in Kasaragod has to certify that the patient is a non-COVID patient and that the required treatment is not available in Kasaragod before an ambulance is allowed to cross the border at Talapadi.
From surveillance at the border to surveillance in our cities, drones have come to the rescue of municipal bodies and police force across the country. Delhi, Guwahati and Bengaluru have used them to sanitize spaces, and now the police are using them to monitor public movement during the lockdown. With some unintentional comic relief, it turns out. Kerala police has released video footage from surveillance drones cut to popular film music and dialogues. And Bengaluru police tried to use one too. Unfortunately, the drone only succeeded in attracting an audience. So Riksha, what would you do if you met a drone?
I hope I never have to kill, at least not while the lockdown is on.
That's right. That's all we have today. For the latest updates, log on to deccanherald.com. Stay safe, stay indoors, and we'll see you tomorrow.